नमस्कार दोस्तों, मैं अमिताभ and you are watching me today, second time on the School Times in Ed Talk special episode on Women's Day. Just few minutes back, we were in an interaction with Dr. Abhilasha Kumar talking about women and health issues in teens and teas, and we were very, very enlightened. And now we have a very, very special guest, and Dr. Chandrima Dasgupta with us, who is going to enlighten. We are going to focus. Her specialty is in a very diverse area. I've requested her because we want to cover every aspect of women's health on this Women's Day special series that we have today. And we are going to focus on women health at 40 plus. And friends, Dr. Chandrima Dasgupta is a senior gynecologist, and she has been associated with, she's practicing in Kolkata, associated with various leading private hospitals in Kolkata. She has, after completing her basic medical training in Kolkata, she did her advanced training in gynecology in UK, has earlier worked as a gynecologist in Queen's Hospital in UK, and then her love for country brought her back in Kolkata in 2008, and since then she has been, practicing in Kolkata. And besides her introduction as a doctor, she loves and takes a lot of pride in being mother of two children. So when she talks about health of people, she has that affection, and she thinks that the biggest qualification is being the parent and mother of two children. She loves gardening, dancing, and painting. A very versatile doctor, and we have her here with us to talk about women health at 40 plus. So, ladies and gentlemen, allow me to invite Dr. Chandrima Dasgupta up on the screen with me.
Thank you very much.
Welcome to Ed Talks with Amitabh on a special episode on Women's Day.
Thank you. Thank you so much for the kind words. And I would like to, wish a very happy Women's Day to all the lovely ladies out there. Women, they are really multifaceted nowadays, and apart from looking after family, they have to also look after their own aspirations, and that can obviously they can fall prey to health problems. Is very natural, and so I think in today's session we'll talk about how to empower ourselves with the knowledge about health, which will help us to strive better.
Absolutely. Thank you so much, Dr. I know that you have a very busy schedule, and for squeezing time out to be with us to educate and empower people. When we talk about women health and at 40 plus, I think 40 plus, generally we say we are on the wrong side of the age, we are on the other side of the age. So one is as it is, there are a lot of issues related to health start creeping in our lives, irrespective of our gender. But then there are a lot of specific aspects related to the body structure. The hormones are very different for men and women. So women definitely, whether it is heart, whether it is various aspects of medical aspect, there is a context added to it. And so my first inquiry from you is that why it is so important to look into women health at 40 plus.
This is the age when you should really look after yourselves if you haven't done so, because one of the aspects of women's health is around 40 is of course there's pressure from both sides, from your family and the work side as well, when the stress gets built up at this age. On top of it, menopause, perimenopausal age starts coming, because average age of menopause is around 46 to 50 in India. So maybe few years prior to this age, the hormones starts declining. The ovaries, they kind of slowly, I wouldn't say around 40, but 45, 46, they slowly start declining. And we know if the hormones are good for our body, in maintaining our various kinds of involved in maintaining our bone health, in cardiovascular health, which is keeping your heart good, and also urogenital problems, bladder problems, and cognitive function, memory and other things, how to function better as from the cognitive aspect. So what I would say, that you have to recognize the signs of menopause, signs of perimenopause, so to say, which are it can be some women, they don't, it arranges, and there's a spectrum, and but many women, they will feel not very good, feeling the hot flushes, night sweats, feeling very irritable, mood problems, insomnia, not having enough sleep. These are the problems, these are the signs you must look for. And of course, to combat this problem, you have to have a very good lifestyle modification. That is a very of primary importance before you take any medicines. Regarding lifestyle modification, I mean, having a healthy diet, exercise is extremely important. More than healthy diet is calcium rich food, again, because the bones, you're at risk of osteoporosis, bones becoming very thin, so from calcium deficiency. So calcium supplement in food is and then normal calcium requirement is about 1200 milligrams per day for a woman. And one glass of milk will provide you about 300 milligrams. So milk and milk products, very important, and green leafy vegetables. So and exercise, of course, exercise not only the normal recommended exercise is around 30 minutes per day, 5 days a week. So by exercise, I mean, like brisk walking or swimming, jogging, and also weight bearing, because the muscles, you have to build up on your muscles also. So weight bearing exercise is important. Apart from that, healthy diet and exercise, there are various treatments available, like hormones. The hormones that are you're deficient, there are ways to replace those hormones. But there is a certain set of criteria which has to be fulfilled before you can actually take the hormones. So it's important that you see your doctor, your gynecologist, before you start taking the hormones. Hormones are very, there are certain contraindications which has to be looked into before someone prescribes hormones. But it's good to build your bones and protect your heart also. Apart from
what you just now said brings me to a very significant clarification. A lot of people say at 40 plus, because of the hormonal changes in women, there is a probability of the heart also becomes very vulnerable, which you just now mentioned. So
Yes.
do you think there is a correlation between the hormonal change taking place 40 plus and the heart issues and the heart ailment?
Yeah, certainly. Cardiovascular problems are very common among women after, around menopause and after menopause. So, of course, there is a link between menopause and cardiovascular health, and whether there is any pre-existing health cardiovascular problems or not, that has to be checked. It's not only hormonal deficiency; there may be some underlying heart conditions which has to be excluded, but definitely there was a notion that hormone replacement therapy increases the risk of cardiovascular problems, but no, it has little or nearly nil effect on the cardiovascular health. But yes, as you said, of course, there's a high increase in risk, and I think we are as women a bit negligent on that issue, and we are not really very vigilant on this aspect. And people have to be, if you have a family history or a very personal history or any symptoms, then of course you have to consult a cardiologist first. And the other aspect of menopause and perimenopause, which I forgot to mention, is very important to look after your mental health, because during this change, you will be able to enlighten us more on this aspect. But mental health, looking after, very important. So to form your own tribe and go out with your friends, have a cup of coffee, and talk about your problems is, I think, it's a very good practice.
Being happy is very important.
Yes,
And
absolutely.
I really fall for all the doctors who highlight the importance of mental health. Being a psychologist
Absolutely.
myself, I really realize the significance of it.
Absolutely. You actually, your contribution is very significant around this age group.
Absolutely. Now, Doctor, this brings me to a query. Like it is said that after 40, the kind of hormonal changes, the certain hormonal formations are affected, and that affects and induces osteoporosis or calcium deficiency and those kind of things. Can you throw some light on that?
Yes, as I said, estrogen is good for your bones. So the as the estrogen starts declining, osteoporosis can set in. Osteoporosis when the bones become very brittle. So you may have pain when getting up or from the bed, or twisting and turning. And of course, this is also related to your family history. Some women, they have more. Significantly more, they're vulnerable than others, and they have a family history. But definitely everyone will go through some change in the bones becoming brittle. And so if you have a significant risk factors, then it's advisable that you do some of the scans like DEXA scan, which measures or bone densitometry, how dense your bones are. It's advisable. And to build up on the bones, as I said, calcium, vitamin D3 are very important, and exposure to sunlight, because calcium won't get absorbed unless you have adequate vitamin D3 in your body. And if you're very low vitamin D3, it's important that you take some supplements. And calcium rich food, important to prevent this or minimize the effects of osteoporosis. And as I said, exercise is extremely important, not only to increase the strength of your bones, but also build up on your muscles. So it should both weight bearing exercise, and also which helps in strengthening your heart. So both aerobics and muscle strengthening exercises.
Absolutely. Thank you so much for enlightening us on that. Also brings me to a point that there are a lot of patients we get, the clients we get, they come up with manic depressive symptoms, and we often found that they do not have the clinical bipolar parameters, but then it is at the it's a premenopausal phase, which is linked to the manic depressive patterns which are there. So if you can just throw some light on premenopausal conditions and the kind of behavioral patterns which come up and emerge.
Mostly it's well, you don't feel very good, so there are hot flushes and night sweats. You do feel irritability is very it's more of the common symptoms is irritability, so you actually get very upset with little things. And insomnia adds to it. You don't have enough sleep at night also. But if there is when you're talking about manic depressive parts, I think you can't always put it down to menopause, because any underlying psychological problems must be explored. So if it is
Right.
very severe, I think we need to exclude other psychological problems, and
Right.
then only treat with HRT if that's excluded. And
Excellent.
HRT causes significant elevation of mood if it is only because of perimenopause hormone decline.
Absolutely. And so if one is stressed out, it is important to rule out both the dimension. If you are 40 plus,
Exactly.
both could be a possible reason for the same.
Yeah, I wouldn't say nearing, around 45, 46.
Right.
So not the early 40s to the late 40s, because the average age, as I said, is around 46 to 50.
46.
So but the ovaries, the function starts declining a bit before the actual menopause sets in, because by menopause we mean when the periods have stopped for about 12 months. Before that, the periods there will be some irregularity in the menstrual cycle, scanty periods, irregular periods, they're spaced out, and then slowly, because it goes through a phase of fluctuating function, the ovaries, before they stop altogether. So that perimenopausal period persists for some time, and then you have the actual menopause.
All right. Doctor, in my understanding, women have particularly Indian women, have a very different level of tolerance for pain. And often that leads to many medical conditions getting ignored, and they do not get the timely, intervention that could have prevented it getting complicated. And one such condition is, ovarian cancer. There's a lot of gynecological cancer pattern are there, and they keep on shrugging it off. And by the time it's too late, then things start getting diagnosed and treated.
Yeah.
Can you throw some light on gynecological cancer screening and the related aspect to it?
Sure. See, the word cancer, actually it evokes such a fear. People sort of go into a denial mode. They don't want to hear about it or think about it. But this is we have to start with a positive note. Many of the cancers are preventable, so that one should understand that. You shouldn't really be scared when we utter the name cancer. Many of these are preventable, and some of these, if you're detected in the early stage, they have a very good prognosis. So most of the regarding gynecological cancers, one of the cancers I like to mention is cervical cancer. First, because cervix is the lower part of the uterus, and cervical cancer is extremely common in our country. And it is preventable. Actually, it is preventable. This is one of the cancers we can pick up from before it actually sets in, and early treatment actually cures it. So this message must go across. So cervical cancer, what happens in cervical cancer is you have some bleeding in between periods, or offensive smelling discharge, or there will be postcoital bleeding. So these are the kinds of symptoms for someone who has a cervical cancer. But before the cancer sets in, there's no way we can the people can be absolutely asymptomatic without any symptoms. So how do we pick this up at this stage? The normal recommendation is between 25 years to 65 years of age, every woman should have a test called pap smear every 3 years. And we can pick up cancer before we can pick up the cells of the cancer cells in the pre-cancerous stage, because the cells go through changes, and slowly they will develop into cancer. So when the cells are going through change, we can pick it up at this stage through this test. So how is this test done? Before that, I must say the cervical cancer is actually, most of the cervical cancers are caused by a virus called human papilloma virus, which is a sexually transmitted virus. The pap smear actually involves a test which can be done in the clinic. It's a painless procedure. Well, any internal test, it can be uncomfortable because it's a private examination, but actually it's not painful. It's a painless test. It takes only a minute to do it. Like in most of the Western countries, they have a nationalized, they have a nationalized program by which you have to actually do it every 3 years, and that way they have, like in UK, they have eradicated nearly this cancer, but it's still so common here. So this through this test, you go to the clinic, and someone who is trained to do it will do the test, and the reports are available within maybe 72 hours, and it tells you whether there are precancerous cells or not. And there are treatments, even treatments by which you can preserve the uterus. Small minor surgeries which can actually treat it completely, and you get better, and then you are in a follow-up. So this is about pap smear, which is a secondary prevention of cervical cancer. And there is primary prevention of cervical cancer also through a vaccine. There is a vaccine available in the market. It's a cervical cancer vaccine, which is given to girls as early as 10 years of old, and it can be taken around till 40. So
Yes.
this vaccine also really, will prevent cancer, because this is, as I said, the virus, it is caused by a virus, which is human
Okay.
papilloma virus, and this vaccine is against this virus. So
Okay.
this vaccine will reduce your chance, by about 85%. So it's
Right.
very much recommended. So primary prevention through vaccine and secondary prevention through doing pap smear tests. So
Okay.
this is about all about cervical cancer, and there are other gynecological cancers also,
Right.
which are like uterine cancer, endometrial cancer, ovarian cancer, and breast cancer. So when we talk about breast cancer, this breast cancer, again, women should have self-examination of breast at least once in a week, and between 45 to 55, at least yearly, they should have screening of for breast cancer by doing mammograms, and after 55 they can have it in a 2 yearly even. Between 40 to 45, if you want, you can have I think it's a good practice to have an annular, or annual checkup of breast. This is regarding breast cancer. Of course, if you have any questions, we can again later on discuss about it, but I'll
Yes.
briefly just tell about the other two cancers, which are
Right.
ovarian and endometrial cancer.
Right.
Ovarian and breast cancer has got a genetic predisposition. If you have a
Okay.
family history, then you are more prone to get these cancers. Like
Okay.
breast cancer, there are two genes called BRCA1 and BRCA2 genes, which women
Okay.
who have this, they are more predisposed to this cancer. Similarly, with ovarian cancer, there is a link up with the family history. So if you have a family history of ovarian cancer, breast cancer, you should be more alert and
Okay.
seek medical help earlier than later.
Okay.
The regarding ovarian cancer, again, is called a silent killer. We cannot always pick it up from beforehand, and they may
Okay.
it's usually not present between 40. About, I would say, ovarian cancer presents at a bit later age, maybe in the
Okay.
60s or 70s. Having said that, it can happen in 40, but more common at a later age. And there may be, vague symptoms like abdominal distension, or some bloating, digestion problems, etc. So
Mhm.
but those with, as I said, with a family history must see a doctor. And there are, although the screening procedure is not as good as cervical cancer, but still it should be monitored. For uterine cancers, again, uterine cancers, they can present as very heavy bleeding, abnormal bleeding, as not maintaining cycle, irregular, aberrant, erratic bleeding. And of those women, most of the women who have this problem, most of them will have some benign pathology which is non-cancerous. So don't be
Okay.
scared. Only a small percentage may have endometrial cancer, but that is only picked up when you see a doctor, you have imaging done, and through a biopsy, which is again a very simple procedure. We take some samples from the lining of the uterus, and although it's done in a in an operating theater, and that's how it's picked up, the endometrial cancers. So this is in short the cancers, gynecological cancers.
Doctor, when it comes to breast cancer or ovarian cancer, uh, as a lay person from outside, a lot of people talk about that. The removal, after removal, things are fine. Uh, the people do not understand the technicality of it. So if you can just throw some light on that.
See, all the cancer, we stage cancers. There are various stages of cancer. As you go up the ladder, the treatment modalities change. So if it is a very, very early cancer, as I said, even in cervical cancer, if it's a very early stage, precancerous stage, you don't even need to remove the uterus. Only part of
Okay.
the area which forms the cancer cells, if that is
Uh-huh.
removed, then it's called cone biopsy or large loop excision of transformation zone. Even by by preserving the uterus, the cancer can be cured. But as you if you move, as we move up the stage in higher stages, then of course that warrants a bigger surgery, a more major surgery, removal of not only the uterus, ovaries, but also the lymph nodes and the fat inside the tummy. So fat means the omentum, we call it, a fatty layer inside the tummy. So and of course, depending on when the reports come back, depending on how far the cancer spread, then there are other treatment modalities like chemotherapy, radiotherapy, etc. So as I said, it is all depends on the stages of the cancer. But please be reassured, if you look after your health enough and go through the screening procedures, then we can stop it from developing, from progressing to that stage.
So, friends, I think listening to Dr. Chandrima Dasgupta explaining this, what is clear to me that disease itself is not that big a problem. The problem
Yes.
is the stage at which you are diagnosed. You're going for the diagnosis, because if just the name cancer is not that threatening, but if we ignore it at an early stage, it
Yes.
takes more threatening uh, parameters, and that's where it gets complicated. So it's important that give importance to your health, love
Absolutely.
yourself, and keep checking yourself for preventive curative measures. That is always going to be very, very healthy and helpful. Doctor, that was very, very insightful. This also, while I was doing my own homework to prepare for this interaction, because I was going to talk about women's health, and I thought that I need to equip myself before I put questions. And while going through the homework on this, there's a correlation between the hormonal changes that take place at 40 plus and autoimmune diseases. There's a probability factor that grows. So, is there a correlation between autoimmune diseases and 40 plus parameters?
Uh, and, I mean, there isn't any direct link. I mean, maybe the symptoms mirror the symptoms of menopause. Maybe that's why there is a correlation. But the menopause is not a cause for autoimmune diseases. For those women who have autoimmune diseases, they have it, pre-existing. Maybe that is not diagnosed, and when the menopausal symptoms occur, it may mirror some of the symptoms of autoimmune disease. But no, per se, menopause does not cause any autoimmune changes in the body.
Okay. Doctor, we received an email from one of our viewers when we promoted Medica Doctors on Women's Day special. And so one of the query was there that how about pregnancy post 40? How safe it is, because the science and technology is advanced. So if somebody is looking for going for having a child, how safe is pregnancy, and what are the factors one should keep in mind?
Okay, yes, that's a very pertinent question, because in present day and age, when women are actually, completing their career, and they're busy with building up their careers, it can sometimes happen that fertility takes a back seat, and so then we start worrying with what will happen because we approach that age. So. I would say that after 40, it's not undoable. I had many women who had children, who had babies when they're at 40 and 42. But of course, you have to understand that compared to 30, at 40, the ovaries, the quality, of course, deteriorates. So the quality of the eggs in your ovary at 30 is much better than at 40. So with a higher number of the poor quality eggs, what happens is, the fertility will decline. So after 35, it sort of slowly starts declining. After 40, it's more. The reserve of the eggs becomes less, reserve of good eggs. So that is one. And number two is the chance of miscarriage is slightly bit more than someone who's at 30 or 35 years of age. And then there are some problems with, there may be some genetic problems with the baby, like a Down syndrome. So Down syndrome risk increases slightly, it increases with age. So Down syndrome, to clarify, it's a genetic abnormality when the children are a little bit different. So that the risk increases with mother's age. But again, we can pick up Down syndrome when you are pregnant. And between 12 to 14 weeks of pregnancy, there's a test when we do a blood test and ultrasound, and we can pick up if the babies have Downs. So, and also with the mothers at 40, again, the risk of the medical problems in pregnancy then can increase slightly, like diabetes or high blood pressure. So it is they obviously, for women at 40, they belong to the high risk category, but it's not entirely undoable. So we're looking at statistics. Compared to 30, 35 is more, compared to 35, 30, 40 is more. So that's how it goes up. But yeah, it is doable. And of course, with reduced, there are artificial reproductive techniques. If it doesn't happen, I would say after 40, if someone is trying to get pregnant, and you try, and after exclusion of every other problems, you need to have some fertility tests done also, and after exclusion of all other pathologies, and if you're trying and not getting pregnant, even with medical therapies, I wouldn't hang on too long before we proceed to artificial reproductive techniques, because if you decide to have a ART, like IVF or whatever, at the age of 45, you have a lesser chance than at 40. So you have to be a bit more proactive.
Okay.
I wouldn't say you get stressed, or you shouldn't get stressed about it, because if you stress, that makes things more difficult. But you should have a plan in mind that if this fails, we go on to the next step, and then we move on, rather than hanging on to the same process for years, for months and months.
Absolutely, absolutely. That's very insightful. In this context, I've read somewhere in that there are possibility that at a younger age, at a healthier age, if the egg and the sperm being frozen, and which can be used at a later stage. So will that be a helpful idea?
Yeah, that is yes, that's within the premises of a fertility specialist, but there are ways, but obviously it's not very easily available, or not that very common, or it can't be reached out to every nook and corner. So it's also a complex procedure.
It's a complex procedure and rare in terms of availability at the moment.
Yeah, availability, maybe, yes, exactly.
Okay. So, Doctor, you just now talked about diabetes, and also is diabetes at 40 plus, because for men and women there are greater vulnerability. So, is it any different, and women need to take some special care when it comes to diabetic health at 40 plus?
You mean with pregnancy and diabetes? Is that what 40? With yes, diabetes in pregnancy is a big problem, and is we have an endemic of diabetes. We, as Asians, we are more prone to be, not very, prone to get diabetes. So your sugar metabolism doesn't work very well, and pregnancy makes it worse. So with someone who has a family history of diabetes, they are more at risk of getting diabetes if they are pregnant. And again, we have to, it's in an ideal scenario, you should have a preconception checkup with your gynecologist before you get pregnant, to see if you have any problems. Because if you get pregnant being very highly, with very high blood sugar, there is a risk of congenital defect, birth defect of the baby. So it's better to get pregnant when your blood sugars are normal. So this is a preconception. But again, for some women, they don't know, and they just comes out, suddenly they find out during pregnancy that their blood sugars are very high, and towards later phase, or maybe after they get pregnant, few weeks later. So in those cases, For diabetes, so it has got a bad effect on the baby. For uncontrolled diabetes, I'm saying uncontrolled, not controlled diabetes. So there may be either the babies become very big, or they may be growth restricted. There may be a lot of water around the baby. There may be sudden intrauterine death of the baby. So and then complications during delivery, even after the baby is born, because the babies are exposed to so much high blood sugar. There may be fall in blood sugar level of the neonates and little babies, and that may be difficult to treat. So they are not. So it's not. So it's very important from the beginning. Diabetes should. We do screening test even at booking, and also at frequent intervals, to pick up diabetes. So we are very vigilant as obstetricians to pick up diabetes for women. And if we have any of these, if it is picked up that is that someone has a very high blood sugar, there are ways and means. We do work together with the endocrinologist. So it's a multidisciplinary approach. And first we try with a diet, and we educate women how to check blood sugars at home. So after that, if it is not if it doesn't get any better with the diet, then there are medicines, and there is insulin. Some women, they are very scared of insulin, that it is going to harm my baby or not. But what I need to stress on the fact that no, it won't harm your baby. On the contrary, it is beneficial, because if your sugars are controlled, it's always good for the baby is happy.
Okay. That's so very informative. Dr. One last question, because one of our viewers just now, Sippy Dubey, has written in a live mode on connected to us through Facebook page. What is surrogacy?
Okay, surrogacy is basically renting a womb. It's renting a womb, which is means that if you have your baby, it may be your baby from which a baby which is formed by fertilization of your egg in a husband's sperm, or maybe donor egg / donor sperm. But after the baby is formed in the early stages, then it is transported in the womb of another woman, and the baby grows there. So that is surrogacy. You are renting someone's womb, because either you have some problem, or you really don't want to grow in your womb, or there are medical problems. There are certain there's some pathology, so some disease, so we can't bear your child. So it grows in the other woman's womb, but it's your child biologically. It's your child. So as I said, it can be biologically, or maybe it may not be, or partly biologically. So after the obviously baby is delivered, that's handed over to the mother. This is in short surrogacy. Surrogacy. There are a lot of controversies regarding surrogacy laws in our country. So I'm not going into depths of the controversies, but. Yes, many women, they go through. Not many women. There are few women every now and then we come across with surrogates.
Thank you for that information. There's one very relevant question being put up by our viewer, Ruma Ghosh. Is there any relation between uncontrolled hypertension and early menopause due to hysterectomy? I'll be obliged if you kindly put some light on this.
The relation between early hysterectomy and menopause, I'll answer that question first. Uncontrolled early one due to hysterectomy. So I don't really get it. Are you saying there's a relation between the two parts? I think is there a relation between menopause, early menopause due to hysterectomy? I answered that part. Yeah, if you have the uterus removed and the ovaries preserved, there is a small chance, around 10%. I think the figure given is between 5 to 10% chance of having an early menopause. It is the ovarian hormones which are responsible for menopause. So if we preserve the ovaries and take just the uterus out, it won't technically cause menopause if it is done in the reproductive age group. But the ovaries, the blood supply to the ovaries to some extent is compromised in some situations. So someone who had a hysterectomy but not a oophorectomy, which is removal of the ovaries, may have an early menopause. Your second part is between uncontrolled hypertension. Not per se, there is no direct link between uncontrolled hypertension and early menopause, but with hysterectomy, yes, there is a relation with hysterectomy and early menopause. I hope that answered your.
Thank you so much, Dr. Sab. I know that now I could see that our viewers have started getting inspired to ask more and more questions, but we have a time constraint. I know you have,
Yes.
medical commitments, but one last, because there is a, if you can throw some light in the context of PCOD. Um,
Polycystic ovarian syndrome.
right.
Polycystic is a very common. It's a very common, and 1 in 5 women in our clinic walking in will have a polycystic ovarian syndrome. Now, I will say that it's particularly applicable for 40 plus, but we see more in the teenagers and the young girls. Polycystic ovarian syndrome, what I have to say, it's not a disease, because I've seen patients coming in running from pillar to post, various prescriptions and files from in the hope that it will get cured. It's not a disease that it will cure, it's just a condition. It's called a metabolic syndrome. What happens is generally you have a tendency for a resistance towards insulin, and some of these women, they have a family history of diabetes again. So the ovaries, the hormones that are released from the ovaries, they are not in the they don't come in the right balance. So that's why you have irregular periods. You can have skin problems like acne, like unwanted hair, and there may be fertility problems, and future there may be diabetes. Yes, with PCO, as your answer, the hypertension, high cholesterol, diabetes, they all go hand in hand. There are obesity, so they all they're like a metabolic syndrome. So and its main treatment is so I didn't get your last question with PCO and
Can PCOD be checked by surgery?
the answer is no. The answer is no, because it's not, as I said, it's not a disease, and it's the main treatment again is lifestyle modification. The more you can, increase your sensitivity to insulin by exercise and diet, etc., all the symptoms will be controlled. Many patients of mine, they come and say, no, my periods have become regular. Whatever the symptoms they've become regularized once I started exercising and being careful with my diet. So it's easy, please, but you have to be a bit motivated. Surgery, there is such. I think what the surgery we were talking about was a laparoscopic ovarian drilling, but that's not again, it's not applicable for all. It is sometimes done during for fertility problems associated with PCOD, but then again there are controversies around it. So no, my answer would be no.
I know there will be a lot of questions and queries. I could see that there's a lot of hope generated by audience that they'll get answers to their questions through you, Dr. Sab. But I know that time is a constraint. वो कहते हैं ना कि हर फूल कब गुलाब होंगे, ऐसे भी चंद सवाल होंगे, लेकिन क्या हर सवाल के जवाब होंगे? There will always be few questions which will remain unanswered. But I promise to all our viewers that all our guests which we are getting on Women's Day special will be requesting for their contact details, whatever they are willing to share. We will post it on the School Time Facebook page for people to get connected and take help from the professionals who are featured on our show. So thank you so much, Dr. Saab. Your final message to our viewers on the occasion of Women's Day.
My final message would be, please take care of yourselves, because we know health is wealth, and please be aware and spread awareness, helping other women also. Please take care. Thank you very much for this session, and I really enjoyed it, and hoping to answer all your questions sometimes.
It's really a pleasure having your time and your availability to us to be in this session, Dr. Saab, and we would love to invite you more often to get and reach out to people, depending, of course, on your availability. So thank you so much for being on our show, Dr. Saab. I know you have commitments waiting, so thank you so much.
Thank you.
Friends, you were listening to Dr. Chandrima Dasgupta, senior gynecologist, associated and connected to various hospitals in the city of Kolkata, and has got vast experience from her responses. You have realized that, and I am very, very educated on women's health today, and we are concerned for all your health, because if we go by the traditional belief in Indian context, we're talking, sounding a little gender biased, a family is often depend on women of the house, and you need to take care of yourself. आपको अपना ख्याल रखना बहुत जरूरी है. हो सकता है आपको लगे इसमें भी हमारा स्वार्थ है, but then do take care of yourself. We love you. You are important to us. And Dr. Chandrima Dasgupta, in so many words, have been trying to get across there is a way out. You need to be timely about your initiative. Keep getting yourself tested at the right time so that you get the benefits, and we all are concerned. So happy Women's Day to all of you, and you all are important. Enjoy it. Friends, you were watching Ed Talks with Amitabh. I am your friendly psychologist, Amitabh Mohan. और आज की इस कड़ी में हमारा अगला सेशन है 6 बजे. At 6 p.m., we are going to talk about women's health and nutrition only on the School Times. इसी पेज पे आप आइएगा. Other link is there on our Facebook page, our YouTube page, our Twitter handle. Please do connect, because we are going to have Dr. Anjali Huda connecting with us straight from Delhi, the capital of India, talking about nutrition and women's health. Till then, stay tuned.